Dear Litvinova medical patients, I've been getting many questions from you that I do try to answer individually, but most of the questions can be compiled in 7 different groups. And I decided to make a video on each group of questions which are similar, the same way I did videos last year. And the most common questions can really be compiled in seven different groups. And I'll be talking about what you can do naturally, about lifestyle changes, diet, exercise, and supplements to address those issues. And the first topic that's been very common is how to stay healthy during an upcoming cold and flu season, how to strengthen your immune system natural way, prevent and early treat possible viral infections. And in the first video, I'll be talking about dietary modifications, lifestyle changes, as well as supplements that you can take on a regular basis, on a daily basis, to strengthen your immune system. The second group of questions have to do with weight. Many of you have gained weight during the pandemic, and although many of my patients have been able to lose the weight naturally and back to their pre-pandemic weight, but there are still patients who struggle with trying to lose weight. And in my second video, I'll be talking about what specific dietary modifications or the way of eating can be changed, as well as supplements that one can take to try to gradually lose weight in a healthy and physiologic way. The third big topic of your questions has to do with fatigue. Stress can lead to fatigue, unhealthy eating habits, poor sleep from anxiety or other reasons. So my next video, I'll be talking about what can cause fatigue, how to evaluate a patient who's been struggling with feeling tired and poor sleep. And the next group of questions have to do with anxiety or mood swings. Unfortunately, one of the most common complaints during the past year and a half have been psychological. And many people do suffer from anxiety, depression, and frequently sleep is affected. And even though I do understand that many patients will need to see a therapist or may need to continue their medications or even start the medication, I do want to talk about what you can do naturally in terms of lifestyle changes, dietary changes, supplements to try to help your moods and try to address anxiety and sleep in a more natural way. Women's health is my area of expertise, and many women have been complaining about symptoms related to hormonal disbalance, such as PMS, mood swings, physical complaints of water retention, not feeling well. And there are many things you can do naturally in terms of certain dietary modification, exercise, supplements that you can do to help those symptoms and start feeling better and not be incapacitated by a bad PMS or heavy periods. Along the lines, thyroid conditions are also very common, not necessarily full-blown underactive thyroid, but Hashimoto's common and sluggish thyroid. The TSH is a little bit off and the thyroid is not working 100%. Not necessarily that the person needs medication, but that can also be helped natural ways by lifestyle changes, supplements, the way people eat. So that'll be my other topic that I'll be doing a video on. And this year, many people do suffer from allergies, and the symptoms can be quite uncomfortable. We do treat allergies with immunotherapy that's available to our patients and over-the-counter medications, but I also want to discuss more natural ways to address allergies by certain changes in the diet, certain supplements, certain homeopathic medications that don't cause side effects but do make you feel better. So those are 7 topics I'll be working on, making suggestions. And also, since I've been recommending supplements, pretty much basic supplements to address each of these conditions, I'll be compiling packages that 3 or 4 major supplements for each condition that you can purchase and start taking on a regular basis, along with the lifestyle dietary changes. If you have any questions, you're always welcome to call the office, send me a message to the patient portal, and we can address if you have any of my recommendations need to be custom tailored. And also the recommendations are very basic, that anybody who has the condition that I mentioned can take for a couple of months. And after 2 to 3 months, most people will feel better. Some people will feel better 20-30%. Some people will feel much better. And after that initial period of addressing the complaints, we can always email me. You can ask me a question, what's next? And then for those of you who did get some benefit, but still there is a room for improvement, we can take it to the next step and do a more detailed approach. You can always send me questions. I do welcome your questions, and I think these videos will be quite helpful. And thank you very much for your kind words about my prior videos. I feel very proud and happy that I did them, and they help many of you. And I hope this project of mine will be helping many of my patients, and it will be an effective way to try to embrace a healthy lifestyle and start taking care of yourself and your loved ones. Thank you for your attention.